Welcome to the Deep Dive. We're looking at a guide today that maps out the healthcare compliance landscape for 2025 in the US and Canada. And wow, it's changing fast.
It really is. You've got technology, new regulations, demands for transparency, security. It's all converging.
Yeah, really dynamic environment.
Exactly. And this guide, it's pretty dense. So our goal here is to pull out the key insights, give you a clear picture of where things are headed, and maybe more importantly, why it matters.
Right, sort of the essential takeaways without getting lost in the weeds.
Precisely. We want to offer that clear perspective.
Okay, so we'll hit the big areas, federal laws, then Canada, then the US states.
That's the plan. Look at it layer by layer. Federal, then Canadian specifics, and then that complex patchwork of US state rules. See how they all interact.
Perfect. So the mission is actionable insights, clarity on the big shifts.
Exactly. Knowledge you can hopefully use. So let's dive in, starting with those federal laws in the U.S.
Sounds good. Let's unpack the federal side. First up, HAPA. Still evolving, right? Especially around what counts as protected health information, or PHI.
Yeah, and what's really interesting is how broad PHI is becoming. It's not just your doctor's records anymore.
Oh, like what else?
Well, think about data from wearables, smart watches, health apps on your phone, even data from, like, connected medical devices someone might have at home.
Huh. So your fitness tracker data could be PHI?
Under certain circumstances, yes. It's all seen as sensitive health info.
Right.
Which means, well, it means enhanced safeguards are needed across the board.
Right. So if you're making a health app, you need APA-level security now.
Pretty much. You have to build in those robust protections technically and administratively right from the start, just like a hospital.
Okay. And telehealth, it exploded during the pandemic. Any specific AP updates there?
Absolutely. The guidelines are getting much sharper, a big focus on end-to-end encryption for virtual visits.
So the video call itself needs to be secure.
Exactly. Secure transmission. And if you're using cloud services to store any telehealth data, those platforms must be IPA compliant. No cutting corners.
It feels like the stakes are higher for messing up, too.
Definitely. The guide points to much stricter penalties, especially for repeated violations.
Ouch. So not just a slap on the wrist.
No. Serious financial and reputational damage is possible. It really highlights why having solid compliance systems in place is just crucial.
Okay, let's shift to the 21st Century Cures Act. Interoperability is the big buzzword there, right? Getting systems to share data.
That's the core of it. The main thing kicking in now is the mandate for all electronic health record systems, EHRs, to use the FHIR standard.
FHIR.
Yeah, FHIR, Fast Healthcare Interoperability Resources. It's basically a common language so different EHRs can actually talk to each other and exchange data smoothly.
So in theory, my doctor could get my records from the hospital easier.
That's the goal. But it means hospitals, clinics, they need to upgrade, modernize older systems to meet this FHIR standard, and they need open APIs.
APIs.
Yeah.
Those are like digital doorways for data.
Sort of, yeah. Secure pathways so different software can share specific information in a controlled way. And importantly, it's also about giving patients better electronic access to their own info.
The guide also mentioned penalties for data blocking. What's that about?
Data blocking is basically when someone or some system intentionally gets in the way of sharing electronic health info when it should be shared.
So deliberately not playing nice with data sharing.
Exactly. The penalties are there to push for more transparency and stop entities from, hoarding patient data in a way that harms care or patient access. It's about creating a more connected system.
Got it. Now, something that feels like it's been talked about forever, a national patient identifier. Any movement there?
It seems to be getting some fresh attention, according to the guide. The potential pluses are pretty big, reducing medical errors from misidentification, making data sharing smoother and safer.
Yeah, you can see the appeal. But the privacy worries.
Oh, absolutely massive privacy concerns. If it ever happened, it would need incredibly strong security. We're talking rock-solid authentication, advanced encryption. Privacy would have to be baked in from day one, a huge challenge.
Definitely. Okay, cybersecurity, always a hot topic.
Yeah.
What new federal rules are hitting healthcare providers?
A few key things. One is mandatory multi-factor authentication, MFA.
So needing more than just a password.
Right, like a code from your phone or a fingerprint. It has to be used on all systems handling sensitive patient data. Adds a vital security layer.
Seems like standard practice now, but good it's mandated. What else?
Breach reporting times are getting shorter, significantly shorter. We're talking 72 hours federally.
72 hours. Wow, that's fast.
It is. It means you need automated monitoring systems that can spot an incident almost instantly and kick off the reporting process right away.
So technology is key there, too.
Absolutely. On the plus side, the guide mentions federal grants and subsidies are available to help organizations pay for these cybersecurity upgrades. That financial help can be really important.
Okay, let's touch on Medicare and Medicaid. How are federal rules changing things there?
The big ongoing shift is towards value-based care, moving away from just paying for how many services are done.
To paying for how well patients do.
Exactly. Rewarding better health outcomes, better quality of care.
And technology plays a role in making that happen.
A huge role. You need strong data analytics to track those outcomes, manage population health effectively. The guide also points to tech that boosts preventative care and patient engagement.
Like those health apps we mentioned earlier.
Yes, mobile health apps, remote monitoring tools, things that help patients manage their own health and hopefully prevent problems, leading to better outcomes.
So pulling all these federal threads together, iPay, Cures Act, cybersecurity, Medicare, changes. What's the big takeaway?
I think the central theme is a really strong push for major tech upgrades. Federal rules are driving the need for new technology, modernizing old systems. Compliance and tech are just completely intertwined now.
Okay, makes sense. Let's head north now. Canada. The guide says it's more unified federally, but provinces still have their own rules.
That's a good summary. Federally, you've got PIPEDA, the Personal Information Protection and Electronic Documents Act. That sets the baseline for privacy.
But provinces can add more on top.
Correct. Which creates this kind of dual-layer system. You have the federal rules, and then you have provincial laws that might add specific requirements.
So what's new with PIPEDA itself for healthcare?
Well, similar to HITA, there's increased pressure on breach reporting. But in Canada, the proposed timeline is even tighter, just 24 hours.
24 hours. That's incredibly fast.
It is. It really stresses the need for automated alert systems, rapid incident management, very demanding.
Wow. And what about patient rights under PIPEDA?
They're being strengthened,
Yeah.
giving Canadians more control, better rights to access their health info, ask for corrections, even request deletion in some cases. So organizations need solid processes for handling those requests efficiently.
Okay, let's look at some provinces. Ontario. What's unique there?
A big one in Ontario is data localization. Rules saying sensitive health data for Ontario residents generally has to be stored within Canada.
Ah, so no storing it on servers outside the country.
Basically, yeah. It means if you use cloud services, you have to ensure your provider has data centers physically located in Canada. A big consideration for tech choices.
Got it. How about British Columbia?
BC has a strong focus on telehealth quality standards. It's not just security, but also standardizing care delivery through telehealth and making sure the software is actually usable and accessible for everyone, doctors and patients alike.
Accessibility, interesting. And Quebec. The guide mentioned GDPR-like rules.
Yes, Quebec's Bill 64, it's pretty comprehensive, very much aligned with Europe's GDPR. A key part is requiring privacy impact assessments for new projects involving personal data.
So you have to think about privacy implications before you start something new.
Exactly. It forces that privacy by design approach. Build it in from the ground up. Don't tack it on later. It makes compliance-first development really critical there.
So navigating Canada means dealing with PIPEDA and these provincial details. What's the bottom line there?
The bottom line is you need tailored solutions. A one-size-fits-all compliance plan just won't cut it. You need systems and strategies flexible enough to handle both the federal baseline and the specific rules in each province you operate in.
Makes sense. Okay, let's come back to the U.S. state-by-state compliance. Sounds challenging.
It definitely is. The sheer variety across the 50 states makes it really complex, especially for organizations operating nationally or doing telehealth across state lines, much more fragmented than Canada.
Right. Let's start with California. They often lead on privacy. What's expected there?
Well, the CCTA, California Consumer Privacy Act, is likely getting broader. Expect stronger protections specifically for biometric data like fingerprints or facial scans, and also genetic data.
So really sensitive stuff.
Extremely sensitive, which means organizations will need tools specifically designed to handle, store, and audit that kind of data very carefully and securely.
And telehealth in California, given how big it is there.
Yeah, likely stricter standards coming for both quality and security in telehealth. More emphasis on strong encryption for transmissions using secure platforms. The guide also mentions potential mandatory annual privacy audits.
Audits. So proving you're compliant every year.
That seems to be the direction, which means needing technology to track and report on those compliance metrics continuously.
Okay, let's jump over to Texas. What are the compliance priorities there?
Texas seems very focused on cybersecurity and healthcare. We might see mandates for zero trust security models.
Zero trust, meaning
Basically, don't trust anyone or anything by default, always verify. It's a stricter security posture. Also, requirements for regular penetration testing, actively trying to hack your own systems to find weaknesses.
proactive defense.
Right. And clear incident reporting rules. Plus, making sure Texas providers are aligning with those federal interoperability rules, the FHIR standard we talked about.
Got it. Up to New York now. What's happening there?
New York's got a couple of interesting focuses. One is health equity reporting, mandating providers to track and report patient demographics and outcomes to identify disparities in care.
So using data to find fairness gaps.
Exactly. Which likely means more need for advanced analytics tools. And secondly, stricter sustainability reporting for hospitals tracking energy use, waste management, that sort of thing.
Sustainability. That's a different go. Down to Florida.
Florida's looking ahead, particularly at AI in medicine, thinking about regulations for ethical AI implementation.
Ethical AI.
Yeah.
Like ensuring algorithms aren't biased.
Precisely. Possibly requiring transparency in how AI makes decisions and audits for bias. Also, Florida's looking at licensing reforms to make it easier for out-of-state doctors to provide telehealth services in Florida.
Expanding access.
The guide also flags Washington, Illinois, Massachusetts. Any common threads there?
Yeah, the general expectation is more GDPR-like data privacy laws popping up in those states and others, more rights for residents, stricter rules for companies, and across the board, really tougher penalties for getting compliance wrong. So looking across all these U.S. states, it's a real patchwork. What's the key message for organizations trying to navigate this?
It really hammers home the need for adaptable compliance systems. You need tools and processes that can be customized for the specific rules of each state you touch. A flexible, state-aware approach is absolutely critical.
All this increasing complexity, federal, Canada, states must be having a huge impact on this sector overall, operationally, strategically.
Oh, absolutely. Operationally, there's just a much bigger administrative burden. Compliance isn't cheap. You need the tools, the staff, the training. It adds cost pressures.
And what about the patient side of things? Trust.
Trust is huge. Patients are more aware of data privacy, especially with all this tech. They expect transparency about how their health data is used and kept safe. Building and keeping that trust is paramount. Losing it can be devastating for a healthcare organization.
It really sounds like technology is both part of the problem generating more data and part of the solution.
Exactly. AI and automation are becoming essential for things like monitoring compliance, finding risks, generating reports. Blockchain is being explored for secure data sharing. And interoperability, getting those EHRs to talk. It's fundamental now, both for care and for meeting rules.
So what does this mean for the people actually building the software, the developers?
It means compliance by design has to be the mantra. You can't bolt on security or privacy later. It needs to be baked in from the very beginning of development.
Integrated from day one.
Right. And because the rules change so fast, they need agile development methods to adapt quickly. Plus, making sure the tech is accessible to everyone, including people with disabilities, is increasingly important, meeting accessibility standards.
So if you had to boil down the overall impact on the healthcare sector.
I'd say it's this deep convergence of healthcare, technology, and regulation. They're inseparable now. And in that environment, partnering with the right solution providers, ones who really get both the regulations and the tech, is going to be absolutely vital for success.
Okay, so looking towards 2025, organizations need to prepare. What are the essential steps they should be taking now?
The key word is proactive. You can't wait. Sitting back is just too risky with potential penalties and breaches looming. The guide suggests several key actions.
Let's break those down. First, invest in advanced technologies. Like what specifically?
Well, think about AI tools for monitoring risks in real time, flagging issues automatically. Maybe exploring blockchain for secure data exchange where it makes sense. Using IoT devices for things like monitoring medical equipment security or even environmental controls in facilities. It's about strategic tech investment.
Okay. Second step. Strengthen cybersecurity. We talked about MFA and pen testing. What else is fundamental?
That zero trust framework is key. Verify everything. Regular tough vulnerability assessments. Crucially, ongoing staff training. Phishing is still a huge threat, so people need to be vigilant. And strong endpoint security on every device that touches patient data, laptops, tablets, phones, everything.
Makes sense. The third point is collaboration across teams. Why is that so crucial?
Because compliance isn't just an IT problem or a legal problem anymore. It touches everything. You need cross-functional teams, compliance, IT, clinical folks, legal, all working together.
Breaking down the silos.
Exactly. They need to regularly review updates, figure out the impact, plan the rollout together. Using shared dashboards or platforms helps keep everyone on the same page. It needs a unified approach.
And the final recommendation. Stay informed. How can organizations keep up with the constant changes?
It takes effort. Participating in industry webinars, going to conferences, maybe workshops, partnering with compliance experts or a specialized legal counsel gives you tailored advice, and just basic stuff like subscribing to industry newsletters and regulatory alerts from government bodies. You need multiple channels to catch everything.
Okay, so as we wrap up this deep dive on the 2025 compliance landscape, what's the final word?
Well, it's definitely complex, definitely challenging, but it also presents real opportunities for organizations that are prepared to adapt and innovate.
And the path forward involves
Being proactive, investing smartly in technology, building that strong collaborative compliance culture. If organizations do that, they can navigate the regulations, yes, but also actually improve patient care, ensure they're operating legally, and even become more efficient.
So it's not just about avoiding penalties, it's about getting better.
Exactly. It's
Yeah.
a chance to improve.
All right, and on that note, maybe a final thought for our listeners to chew on. With healthcare, technology, and regulation weaving tighter and tighter together, how might this fundamentally change the relationship between patients and providers, and really the whole future of how healthcare is delivered? Something to think about. Thanks for joining us for this deep dive.